All right, so today we're going to go over how to do a bed bath with the occupied bed making. So the first thing I'm going to do is I'm going to have all my linens here, and we've already mentioned in class earlier for you to write down that list of that. I also have my basin for my water. So I'm going to go ahead and get some warm water in there. I'm going to have my patient test it. Can you go ahead and tell me if that's too hot? Perfect, perfect, perfect. Then I'm going to have me some soap here. So I'm going to wash my hands. I'm going to do my hand hygiene. Of course, I have gloves on. So I'm going to let Miss Mott know that we are going to do her bed bath and that I'm going to go ahead and change her linens. So can you raise this for me? Raise the side wheel. All right. So we're going to go ahead and begin. So the first thing I'm going to do is I'm going to get my towels here. I am going to get a chair to put my linen bag on. Okay, so I do not put my linen bag on the floor. It's an infection control issue, okay? So I'm just going to open it up, set it in the chair where I can drop my linens. Now, we're going to reuse this spread. So the way we're going to take this off is that I'm going to fold it down. Okay. Okay. Can you hold that top sheet for me? All right, so I'm gonna get the patient to hold that sheet so it doesn't keep coming with us. Okay, and when I get to the very bottom, I'm gonna pull it out from underneath the tucking, and I'm gonna bring that over. I'm gonna pick it up in the middle where it's folded, and I'm gonna put it over the back of my chair. I wanna make sure though that it is not touching the floor. All right, that way we can reuse that afterwards. So the next thing I'm going to do, I'm going to put my bath blanket on. Now, anytime we do any linens, bath blankets, anything like that, we can't shake any of it. So we're just going to open it up. This does not have to be open completely. Halfway is fine, as long as it's covering your patient, okay? Next, what I'm going to do is I'm going to untie my patient's gown. And we're going to go ahead and take her arms out. Okay. Let's take out that other one. Okay. And then I'm going to get her to hold the bath blanket for me. And I'm going to pull her gown and her top sheet out all at once. Okay? Okay, while I'm keeping her covered. Okay, so I'm going to roll this up as it gets to the bottom. I'm going to hold it against my, away from my clothes. And we're going to put that in our linen bag. Okay, she's covered. All right, so the next thing I'm going to do is put the towel in my water. I have an extra one in case my other one gets dirty. So this is my dry towel. So to start, I'm going to put it right here, okay? And then I'm going to wet my towel and then wring it out, and then remember we're going to do our hand mitt. Grab it and go around, bring it up and tuck. So the first thing I'm going to start with is her eyes. So I'm always going to start from the farther side, and of course I don't want to put any soap in her eyes. So each eye is going to have a different corner. So inner to outer, inner to outer. Now I'm going to ask her if she wants soap on her face. You want soap on your face? No. So this, yes. So now I'm going to give her some soap on her face, and I'm going to clean farther side, clean her ear, clean her neck. Then the other side, clean her ears, clean her neck. Then I'm going to rinse and dry. No, excuse me. This is rinsing. Okay. And then I'm going to take this towel. I'm sorry, and dry, okay? And get her ears, get under her neck. So now I'm going to take my towel out of the way here. I'm actually going to shift this to where it's easier for me to work. Move my collar. All right, so next what we're going to do is we're going to make sure that we're keeping her covered now because we're going to start getting her wet. We want to make sure she doesn't catch a chill. So we're always going to start from the farther side away. So we're going to take our towel, we're going to cover just that one arm. And we're gonna put this towel under her arm, okay? Now, we have two options on that arm. We can lay it like that, or I can bring it across and do it like this to where I'm not leaning as much, okay? So I'm gonna take my towel again, I'm gonna make my mitt. Okay, now I'm gonna soap it, okay? I'm gonna ask her if she wants her hands soaked.
Yes.
Okay, if she says yes, what we're gonna do is we're gonna take the basin, we're gonna soak her hands for 3 to 5 minutes, okay? So it's been 3 to 5 minutes, so we're gonna remove that, okay? And then I'm going to rinse. So I'll always soap, rinse, then dry, okay? So now I'm rinsing. I'll rinse her hands, okay? Now, last thing I'm gonna do is wash underarm, rinse, and then I'm gonna dry all together, okay? Okay, I'm gonna make sure I get under her, in between her fingers real good, get under her arms, and then I'm gonna offer her deodorant. Do you want deodorant?
Yes.
Okay, so we got all the deodorant there, and we're gonna put it on. So next, what I'm gonna do is I'm gonna move this towel, put her arm under, and then we're gonna move to the other side. Okay, can you raise your arm for me? Alrighty, put it down. Alright, I'm gonna make our mitt again. Okay, so I'm washing. Okay, we're gonna soak her hands. All right, how long? 3 to 5 minutes. All right, so we're gonna take it out, and now we're rinsing. Okay, okay, and now soaping under the arms, gonna be last. Okay, and rinse. Now we're gonna dry everything. Okay, again, make sure we get between her fingers real good, get under her arms, and then we're gonna put her deodorant on. So next what we're gonna do is we're gonna go to the chest. So we're gonna have our towel, it's gonna be folded in half, and I'm gonna cover her chest, and then I'm gonna see if she can hold this towel for me. Okay, and then I'm gonna slide her bath blanket just to her waist. Okay. Alright, so we're going to start with the breast first, and what we're going to do is we're going to do circular motions. Alright, so what I'm going to do is just kind of tint this towel a little bit, okay? Kind of make it to where it'll stand up a little bit. That way I want to try to give her a little bit more privacy. So we're going to tint that. Now I'm going to move this just to show y'all. So when you're cleaning under the breast, you always lift back hand up, okay? So we would lift, circular motions, lift, circular motions, okay? Then do the same thing when I would rinse, circular motions, lift, circular motions. Now, just use my towel, I dry, lift, and dry, okay? Now we're gonna move to the belly. So on the belly, we want to go back and forth motion, okay? So we're gonna raise this a little bit, back and forth. If they have skin folds, I wanna make sure I'm going in between the skin folds, and then in their belly button, I wanna make sure that I'm getting in there, okay? So wash, rinse, and then we're gonna dry, okay? Again, when I'm drying, I'm making sure I'm getting in between all the skin folds and inside that belly button. All right, so next I'm gonna bring this up, and I'm gonna pull this towel from underneath, okay? So now I'm finished with the top section. So once I'm finished with the top, then what I'm gonna do is I'm going to change out my water, okay? So go on, I've changed it out. I'm gonna have her test the water for me again. Good, it's still good. All right, so now we're gonna move on down to the lower extremities. So again, I'm gonna start on that opposite side. And when I go down to the lower extremities, when I cover her, I'm gonna open her legs a little bit, I wanna tuck this right here. So if somebody comes in, she's not open to where everyone can see her, okay? And then I wanna open this long ways, so I'll have enough to go under the whole leg and to be able to dry her all the way up and keeping the bed from getting too wet. So next, again, we're going to do the same thing. Now, before I can clean the lower extremities, I need to ask my patient, has she ever had any blood clots?
No.
Okay. If she's never had blood clots, then we're going to go long, firm strokes, okay? Now, if she tells me she has a history of blood clots, or she's had them in the past, or she's currently got them, very light pats, okay? Because if not, we can dislodge that clot and it'll flow to her lungs, heart and lungs, and she can die. So we want to make sure that we don't dislodge anything. So now I'm going to rinse. Okay. And then I'm going to dry. So now while I'm drying, I'm going to ask her if she wants to soak her feet.
No.
Okay. So she said no, so we're not going to soak them. But if she wanted to, it'd be 3 to 5 minutes. And then also we always need to make sure that they're not a diabetic and they don't have any open wounds or have vascular disease. Okay? If they have any of those diseases, we would not be able to soak the feet. So next I'm going to move to her feet. Okay, so I'm going to clean them real good. While I'm cleaning them, I'm checking under that heel. I'm checking for pressure sores. I'm cleaning in between those toes real good. I'm checking for any type of foot fungus or anything like that to make sure everything looks good. So now I'm going to rinse. Okay, between those toes. And then definitely when I dry, don't forget, we want to dry really well in between all those toes. So we want to make sure that everything's clean and dry. So now we're going to move this towel. We're going to cover her back up. And I'm going to repeat the same thing on this side. So everything that I just did on that side, I will repeat on this side. So once I finish this side, then I'm going to change my water again, okay? So go, change my water. Going to get her to test my water for me again. Still good. All right, so the first thing that I'm going to do is I'm going to have her turn on her side, okay? So we're going to turn this way for me. Okay. All right, I want to try to keep her as covered as I can. I'm going to take this, put it behind her back, and then I'm going to wash her back. So when we wash the back, we go from top to bottom in circular motions, okay? Then also while I have her in this position, I'm going to ask her if she would like a back rub.
No, ma'am.
Okay. If she said yes, we would start from the bottom up and we would go circular motions like this and then out, okay? So up and out. And they say for about 10 minutes. So just depending on the patient and how much they can tolerate and what's going on with them, okay? So we're gonna wash the back. We got our mitt, okay? Circular motions, we're gonna clean, gonna rinse, okay? And then I'm gonna dry, okay? So at this point, if she wanted that massage, I would get some lotion and I would do the massage. Okay, so now I'm gonna get her to move back on her back. Okay, so at this point, we're gonna do peri-care. So I would offer it to the patient or I can do it for them. So yes. So can you do your own peri-care?
Yes.
Okay, so since she can do her own peri-care, what I'm gonna do is I'm gonna get her basin with her water, her soap, her towels, and I am going to put it in reach for her to do it. I'm gonna give her a couple minutes to take care of it, and then I'll come back and finish. So she's handled it all. So now we're gonna turn her back on her side, and we're gonna get her buttocks last. So let's go back this way. Again, I wanna make sure that I'm keeping her covered, okay? Gonna put this under her buttocks. All right, so I know y'all can't see me from this angle, but what I'm gonna do is I'm gonna clean both butt cheeks first, okay? So I'm soaping both sides, I'm rinsing both sides, and then I'm gonna pat her dry. Now what I'm gonna do is I'm gonna spread the buttocks and I'm gonna clean in between the buttocks. Also, when I'm doing that, I'm looking for any skin breakdown, any signs of yeast, anything that's abnormal. So I'm also gonna wipe from front to back, Okay, so I got my soap. I'm gonna spread. I'm going from front to back. I'm gonna rinse, and then we're gonna dry. Okay, and we want to make sure that we dry really well in there. Okay, to prevent any yeast or anything. So at this point, we're gonna go straight into making her bed. Okay. Okay, I'm gonna bring the bed up just a little higher. Okay. All right, so the first thing that I'm going to do is let the patient know, okay, we're done with your bath, but we're going to go ahead and change your linens, okay? So you can take the pillow at this time if she can tolerate it. Are you okay without the pillow?
Yes.
Okay. So we're going to move the pillow. I'm going to take the pillowcase off. I'm going to put my pillowcase in there, and then I'm just going to put my pillow on my bedside table or wherever I can that's clean, okay? So I'm going to start by taking off the bed linen. We start at the top, down. As I'm taking it off, I'm going to tuck it as far as under the patient as I can get it. Now, if you tuck into the bed, if you press into the bed, it goes under the patient a lot easier, okay? So we want to get that over and under as far as we can. So whenever we turn them to pull it out, we don't have to work as hard, okay? So now I'm going to take my bottom sheet. Again, we're not going to fluff it like we're at home, because I fluff mine at home. All right. All right, so I'm going to take the top corner. Bed. Okay. Take the bottom corner. And then I'm going to tuck it under the dirty linen. I'm sorry. All right, again, we're just going to tuck into the bed and under that dirty linen. As far as over that we can get it. Okay, and now I'm going to do my draw sheet. Okay, so I'm going to take my draw sheet. So when I fold, when I have the draw sheet, so a couple of things I want to make sure. Number one, that it's wide enough to go from one side of the bed to the other. So usually what I'll do is I'll lay it over my patient, make sure that it's going to fit from one side to the other, and then I also want to make sure that it's long enough and wide enough. Also, the smooth side goes up under your patient because they usually have a gown on and that would be open, and that if it's not smooth, it can cause a skin breakdown. So I'm going to take this, we're going to fold it about halfway, then I'm going to tuck it under my clean linen. Okay. So now I'm going to have my patient roll over. I'm going to let them know it's going to be, you're going to feel a big hump. Okay, so come on over. I'm not going to let you fall. All right, I'm going to try to keep her covered. I'm going to pull this rail up so she's got protection. All right, and then I'm going to head to the other side. So again, we're going to take it off from top to bottom so we don't get all the dirt to the top of the bed. Okay, rolling it, keeping it away from my body. And then we're going to go ahead and pull everything out. All right, so you can roll on back over for me. Okay. So now I'm going to go ahead and put the gown on. All right, can you take your arms out for me? Oops, let's keep you covered. And then I'm going to slide her bath blanket out. All right, so now when I tie her gown, I want to tie it on the side of her neck, okay? So now we want to tie directly behind the neck because they can lay on that tie and it can cause a skin breakdown. So either side, it doesn't matter that we would tie it on. That way, even when we turn them, that ties in that notch of the neck and it's not causing any pressure, okay? So next what I'm going to do is put on her top sheet. All right, so when I put on the top sheet, I want to make sure that this smooth side of the hem is facing the patient and not the rough side, okay? All right, can you hold that for me, please? All right, so now at this point, what I'm going to do is I'm going to take it and I'm going to kind of judge and pull it up to make sure that there's enough sheet that's going to reach up to the top of the bed, okay? All right, I'm also want to look side by side and make sure that they have approximately the same amount of sheet hanging on each side. So next what we're going to do is we're going to take our spread. I'm going to lay it back across. Okay. I want to make sure I have approximately the same amount on each side. Bring that over. Bring this up. Okay. All right, so now what I'm going to do is I will show mitered corners in person and not for the video, okay, because y'all can't really see that in the video. So next what I'm going to do is take the top sheet and the spread and fold them down together. Okay, and I would fix that side once I went back around it. So lastly, we're going to do our pillowcase. So to do the pillowcase, we're going to start with our pillowcase inside out. Okay, so I'm going to turn it inside out. And then I'm going to put my hand in the inside, all the way at the bottom, and I'm going to grab it in the center. Then on my pillow, if it has a tag, I want the tag to be inside. So I'm going to grab it at that center and just bring this around. Okay? I never put it under my chin. I don't shake it. I don't do any of those things that we would do at home. Okay? Now, if we're going to say the entry door to her room is on this side, so the smooth side of the pillow needs to face the door. Okay? All right, and then I'll fix this side, and then she is done. Are you comfortable?
Yes, ma'am.
All right, so that is it for bed making and bed bath.